In our HealthCast today, a huge study released this week finds that Hispanic men have a greater chance of developing higher risk localized prostate cancer and are less likely to be treated for this disease. Dr. Brandon Mahal with the Sylvester Comprehensive Cancer Center and co-author of this review of more than 900,000 men from a national database study. The team also found differences in risk when looking at the patient's country of origin.
We think that the predominant reason for the differences are largely driven by social cultural differences, differences in access to care, socioeconomic differences, but there could also be some differences that are driven by ancestral differences as well.
Now, researchers hope the findings will raise more awareness among Hispanic men about the importance of prostate cancer screening. And on the subject of prostate cancer, another study found that mental health issues among patients are often overlooked. More than a third of the men with newly diagnosed prostate cancer had at least one mental health issue, according to this study. Almost 30% had fear of cancer recurrence or poor prognosis, and 22% met the diagnostic criteria for depression and anxiety. Researchers say mental well-being should really be considered during routine follow-ups with prostate cancer patients. And we have another study, this one by the American Heart Association, finding that health screening and genetic tests might identify more than 1 million U.S. adults at a higher risk for something called familial hypercholesterolemia. It's a condition you inherit that causes elevated levels of bad cholesterol, which can also lead to cardiovascular disease. Now, researchers said that identifying that condition early on in adulthood will create the opportunity for earlier treatment and prevention of heart attacks and death.
Well,